we're both unmuted at the same time, so
Mhm.
I'm going to say my questions quickly
Sure.
and then I'll mute myself so it doesn't affect you.
Okay,
Sorry.
no problem. Yeah. Hmm.
So could you just state your name, Fo, and your position at CAR?
Sure. Niemi, Executive Director of CRAR.
Wonderful, thank you. So does the case of Joyce Echaquan, is it a standalone case of intense racism, or does it speak to the lack of uh, improper healthcare that racialized patients experience as a result of a system plagued by systemic racism?
Well, Joyce Shakwan, we don't believe it's an isolated case. We're talking here about systemic racism, systemic barriers to equitable healthcare services, equitable care, to simply put, and also the question of being treated with dignity, with full equality, as well as with the full quality of the healthcare services. So we've encountered many of these situations in different circumstances, and we believe that it's pervasive. And it may be worth noticing that Joyita Shakwan, in addition to the coroner's report, both the Order of Nurses and also the College of Physicians have started to address systemic racism. Now, how much they have uh, done this, we don't know, but at least they recognize systemic racism despite the Quebec government's persistent denial of the existence of the problem.
Um, for a lot of people who aren't affected by systemic racism and, as in tune with these issues, I guess I noticed a lot of shock with the video and the coverage of Joyce Echaquan's death. For someone who represents people affected by all issues, but most specifically uh, systemic racism within the healthcare system, such as the cases that you sent to me the other day,
Mm-hmm.
um,
Mm-hmm.
what would you maybe say to people who can so easily ignore this as an issue and maybe doesn't realize how integrated it is within our system?
Well, systemic racism in healthcare actually speaks to several issues. There's an issue of lack of access or the unequal access. There's also an issue of lack of adequate care, and this could be more universal for everyone in terms of the lack of the quality, lack of quantity of healthcare services. Sometimes people have to wait for a long time and situation deteriorates, especially when one is poor, one has poor healthcare services. There's also the fact that whenever a situation of apparent discrimination occurs, how the system reacts to complaints, how it reacts to denunciation, that in itself is very telling. I wish to possibly underline the recent publication of the report by the MUHC about systemic racism in hospitals and institutions under the MUHC sort of umbrella. And lo and behold, there was all kinds of control, all kind of shall we say that uh, acts to avoid even the use of the word systemic racism, and the authors couldn't speak to the media and could to be more fully available to answer public questions about the report. Where the report has gone, we have no idea how it's going to be implemented. So the institutional response to complaints of systemic racism, it should be considered in and of itself also a barrier to equal access in healthcare. And we've seen quite a lot of that, whether we deal with indigenous people, we've seen it with people of color. We've seen very often how the systems, the procedures, and the mechanism designed to handle complaints or to prevent these situations from happening, basically these systems and procedures just don't work for people of color and for indigenous people. And that's so far, the few cases we have, that's what we've seen across the board.
Thank you. Speaking of the way institutions react to, you know, calling out systemic racism, I guess I want to talk about Legault. Why is him repeatedly denying that systemic racism exists in Quebec, why is it so dangerous and detrimental to fighting it?
Well, why? I guess we have to ask the premier himself as to why him and his government have consistently and persistently denied the recognition of systemic racism. But we should also mention that the previous government of Philippe Couillard also backed away from the recognition of systemic racism. We believe that for many people, members of the Quebecois majority, talking about systemic racism, it's seen as an attack on the Quebecois nation and basically on the Quebec people, because of that fundamental misunderstanding or the fundamental reluctance to understand what exactly systemic racism is, what systemic discrimination is. You know, strangely enough, the first article of the Pay Equity Act of Quebec recognizes systemic discrimination against women in employment, which leads to pay inequity. So systemic discrimination against people with disabilities, against women, against indigenous people, it's recognized in many laws and reports and policies, but there is this shying away of using the word systemic racism, maybe because of a lack of social, political, or emotional maturity vis-a-vis the use of the term. But it's a real problem on the ground, and we have to recognize that systemic discrimination based on race, gender, or even on income or social condition and social status is a real problem. We do see a lot of systemic sexism. We haven't seen systemic homophobia, so why can't we recognize systemic racism? It doesn't make any sense.
Thank you so much. I wanted to ask about one of the cases that you sent me that you represented,
Mm-hmm.
Winston Nelson.
Mm-hmm.
Would you say that this specific case, of course, as well as many others, speak on how healthcare is ignored and not prioritized for Indigenous people who live on or off reserve, as well as other people of color in Montreal, Quebec?
Right. I think, as in the case of Joyce Echaquan, I think the systemic discrimination directed at Indigenous people in healthcare institutions operates at many levels. It involves explicitly negative attitudes based on racist stereotypes, words and conduct that are clearly, shall we say, denigrating towards people of indigenous backgrounds. But more implicitly and more, shall we say, more subtly, is a kind of quiet discrimination in terms of subtle denial of healthcare access or the denial or the provision of low quality healthcare. In the case of that you just mentioned, is that basically both him and his wife encountered many of these acts when they went to the hospital near their community in Kanatesake, and apparently it's not an isolated case because other people in the Mohawk community there talked about it as well, and it's being recognized. And when you go to the hospital, if you're Mohawk, if you're seen as a First Nation person, and if you're from the Kanatesake community, be prepared to be badly served. It's like we call it a lower quality service, and it's obvious. So we're trying to basically to document and bring out more background information about the pattern of, shall we say, either mistreatment or low quality treatment, like the underservicing of indigenous people.
And it got me thinking in the article that you sent, it said that the closest hospital to him was about like 25 kilometers away, something around that. Do you think that there's, how do I word this? That kind of highlights the lack of priority to Indigenous communities with the hospital being so far away? I mean, understandably, in more urban settings, we do have more hospitals, but yeah.
Well, maybe we have to look at the broader level, maybe our healthcare system needs a lot of, shall we say, creative reorganization and redesign. But then the other issue that we've seen more and more in new protection is that whether we need also to rethink and redesign our health and social services in a more creatively, culturally sensitive manner, as soon as to better accommodate and better adapt and better to respond to needs of First Nations people and Inuit people in a way that could really recognize, among other things, the right to cultural safety and the right to dignity as they see it, not as how the system sees it. And of course, there's also the other elephant in the room is when we talk about systemic racism in healthcare or in any of the public institutions in dealing with indigenous peoples, we have to ask the question is, where are the indigenous people among the staff, among the managers, among the healthcare providers within that institution? Because all healthcare institutions and social service organizations under the Quebec government are regulated by the Employment Equity Act. It's a mandatory employment equity legislation that Quebec has adopted since 2001 that requires this institution to ensure equitable representation, in this case of Indigenous peoples, in all job categories. So if Indigenous people are not fairly represented, where are they and how come they're not there? And whether being there, being part of the decision-making process and the healthcare delivery system, whether that can also have a more positive impact on social services and the delivery of healthcare. And that's a question that we also need to ask more and more as well, because if you're shut out with the system, shut out of the decision-making process, and of course, these programs and services will continue to be oblivious to the community's needs and even demands.
Would you say that the Quebec government is not upholding the Employment Equity Act in the healthcare system?
Well, that's the sort of I don't know, the $6 million question, because the act has been shown to be not working not only for Indigenous people but also for quote unquote visible minorities and for people with disabilities as well. Because of the lack of enforcement. It's a very, very interesting legislation. We were part of the legislative process back in 2001 that led to the adoption of the act. So we know that the act is very unique. It's mandatory. It applies to all municipalities, school boards, and healthcare institutions. But we know that they're not being implemented. These employment equity measures are not set in motion, they are not monitored, they are not evaluated, and therefore in the end there's no accountability. And if there's no accountability for employment equity, there's no accountability for quality health care for people from First Nations and racialized people as well.
Sorry, thank you. What else did I want to ask? Yeah, I was curious what your thoughts were on the following Joyce Echaquan's death. The provincial government implemented a sensitivity training for healthcare workers, and it consists of an hour and 45-minute long online course. But this is, of course, led by the government.
Yes, it's been brought to attention last month that the Ministry of Health and Social Services, the Indigenous Awareness Training package is designed, first of all, it's in French only, so that's also a challenge for many English-speaking institutions. But more importantly, the Inuit dimension is rather absent. And in that Indigenous training program, there's a lot of mixed up with the First Nations and Inuit. And then there are certain stereotypes of the Inuit that are perpetuated, either intentionally or unwillingly, but there are some major deficiencies. And then again, it's a matter of ensuring that these training programs are designed with the participation of the very people concerned, First Nations, Inuit, and other healthcare professionals who have that expertise in dealing with these communities. And that's why it has to be written as a requirement often, and also have to ensure that the training package is available in French and in English, because a lot of indigenous peoples in this province, including the Inuit, speak English, and we have to ensure that our English-speaking healthcare professionals are also equipped with this cultural training competencies in English so as to better serve the population that they're supposed to serve. I'm not blaming the healthcare professional. I'm just blaming the system as a whole that has to find different ways of being more inclusive in the design, in the development, in the implementation of these training programs, in order to avoid unwillingly perpetuating stereotypes and omissions that can lead to more, shall we say, insensitivity and culturally misadapted services.
Thank you so much. And I just wanted to ask, I mean, I'm sure there's a lot you could say on this, but maybe some main points of what change would you like to see, maybe not just from the provincial government, but maybe as well if there's anything that the municipal and federal government can do to, I guess, revolutionize the system.
Well, it requires political will. Right now, we see that the federal government is truly committed to an anti-racism strategy, to equity, and to inclusion, and it invests millions of dollars into these initiatives. So I think that's the most concrete confirmation of the government's will at the federal level. Provincial level, we're not sure. We don't have much hope. Municipally, I think the city of Montreal is trying to put in place many programs and measures and services. So, and there are budgets and resources allocated to that. So it's a very positive. But ultimately, it's not about throwing money at the problem. Ultimately, it's somewhere there must be a requirement of accountability, of deliverable outcomes. We're all required to produce work tangibly and concretely, quantitatively and qualitatively, but when it comes to delivering results on employment equity or combating discrimination and profiling, on enhanced access with discriminatory barriers, the line of accountability is usually blurred, and in the end nobody is responsible if the outcomes or the results are not there, and that's why the system doesn't change. People should be made aware of the fact that their contract renewal, their performance evaluation, or even their appointment or reappointment are conditional upon the delivery of concrete results on equity, on diversity, and that's the only way things can change. Or unless there'll be more class action lawsuits against the system for failure to end discrimination and to serve people without disparities and inequities.
Thank you so much. Was there anything that I didn't ask that you wanted to add, or maybe any updates to the cases that you've been representing?
Yes, just want to, as a footnote, as you know, right now there are class action lawsuits going on in British Columbia and in Ontario on the issue of the birth alerts, basically the practice of removing a child from the Indigenous mother, usually newborn babies, because of all kind of stereotypes and forms of profiling involving poor motherly skills and poor maternal care for the Indigenous child. And we've been told that apparently in Quebec birth alerts are also happening. So I guess sooner or later there will be a class action lawsuit, and maybe that's one way to make people aware of systemic racism and to find ways to end it.
Please do keep me updated. If anything furthers with that, I'll keep my eye on it, but I know you'll probably be the first to know.
Yeah. I think that Concordat is a well-known. This is a complete and an aside and off the record. At Concordat, there's a well-known professor named Kathy Richardson, indigenous professor who is recognized as an expert on many issues of indigenous people, particularly in health education and other public services. And I think that she could eventually be also an authority on these issues. Especially with the research and the consultation that she provides in addition to her regular teaching. So you may want to reach out to her.
I will do so. Thank you so much for recommending.
Yeah. Okay, great.
Perfect. Thank you so much for your time. I really appreciate it, Fo. And
okay, you're most welcome.
I'll be in touch.
Yeah, if you need something
Thank
more,
you.
well, we'll make sure that you're kept informed of the developments in the case of Inuit children and your protection as well.
Please do, yes, and I probably will reach out soon.
Okay, great. Take care.
Have a lovely day. Thank you so much. Okay, talk soon. Bye.